Approximately 1/3 of all diabetes patients develop kidney or renal damage, also known as diabetic nephropathy. Urinary proteome analysis is an innovative method for early detection of this chronic kidney disease, enabling the identification of first clinical signs. The kidneys are highly developed organs that are very sensitive to any problems, for example in the case of diabetes, and can respond appropriately. They clean the blood and remove waste that leaves the body in the urine. The kidneys are made up of about 1 million filters called glomeruli and canals called tubuli. The process of filtration takes place in the glomeruli. About 1,500 litres of blood pass through the kidneys per day. While toxins are removed, a large amount of important substances are recaptured by the tubuli. Eventually, all toxins are discharged in about 1.5 litres of urine each day. When renal damage occurs, the filtering process as well as the reabsorption process become more and more limited. Diabetes-related high blood sugar levels cause permanent damage to the filters. In addition, diabetes patients often suffer from high blood pressure, intensifying the renal damage. The reduced ability to filter thus becomes evident in an increasing amount of important proteins, such as albumin, leaving the body. The detection of proteins in urine is generally the first indication of such renal damage. A decreasing filtration rate, so-called GFR, is another indicator. Clinical signs such as pain or discomfort do not occur, with the result that diabetic nephropathy is most often only detected at a very late stage of the disease. An ongoing decrease in filtration eventually leads to irreversible chronic renal failure. When the kidneys are permanently damaged and no filtration happens, transplantation or dialysis is required. Otherwise, the body will be poisoned within a few days. Dialysis replaces the cleaning process of the kidneys and takes place every 2 days for several hours. During this time, quality of life is significantly reduced. Dialysis replaces kidney function for just several years, as only 15% of the performance of healthy kidneys can be achieved. Kidney transplantation is the only long-term alternative option. Only a few patients can benefit from transplantation as the number of available organs is limited. However, the transplant's durability is limited. Urinary proteome analysis is the only diagnostic method enabling the detection of early renal damage with high reliability and before any clinical symptoms occur. Up to 6,000 proteins can be detected simultaneously. Using 273 specific protein markers allows an extraordinary accuracy in diagnosing diabetic nephropathy and enables early detection of disease. At this early stage, diabetes patients can contribute actively and successfully to manage their disease and its complications. Early therapy can prevent or delay renal damage and allows a life free of afflictions. Worldwide renowned physicians recommend the application of urinary proteome analysis. Get your health checked for a longer and healthier life.
Your doctor may recommend dialysis, a procedure that removes waste products from your blood if your kidneys are not functioning properly. Healthy kidneys filter out waste, excess fluid, and electrolytes like potassium and sodium from the blood. These waste products exit the body through the urethra in the form of urine. If you have kidney disease, your kidneys gradually lose function, leading to an accumulation of harmful wastes and excess fluid in your body, increased blood pressure, and bone or blood problems. Dialysis can also be done to treat acute kidney failure, which occurs when your kidneys stop working suddenly, or to remove drugs or poisons from your body. In one type of dialysis, called hemodialysis, your doctor will use a machine called a dialyzer to clean your blood outside your body. Some weeks or months before you begin hemodialysis, your doctor will prepare a vascular access site on your body. Your doctor will create either an arteriovenous graft or an arteriovenous fistula to access your bloodstream. To begin, he or she will numb the area with local anesthesia. To construct an arteriovenous graft, your surgeon will make a small incision in your forearm and insert a soft plastic tube called a graft to connect an artery to a vein. To create an arteriovenous fistula, your surgeon will make a small incision in your skin and connect an artery with a vein to make a larger vessel called a fistula. Once your vascular access site has healed, your doctor can start hemodialysis. To begin, your dialysis nurse will insert 2 needles into your AV fistula or graft. Once the circuit is set up, your blood will flow slowly out of your body and through the dialyzer. Inside the dialyzer, your blood will encounter filtering fibers and an absorbent cleaning solution called dialysate. The fibers will remove waste and excess fluids and electrolytes from your blood. Your cleaned blood will emerge from the dialyzer and continue through the tubing back into your body through the second needle at your access site. When your hemodialysis session is complete, the needles and tubing are removed, and you can go home. In another type of dialysis, your doctor will use the membranes lining your abdomen, called the peritoneum, to clean your blood without removing it from your body. Before you begin peritoneal dialysis, you will have an operation to implant a soft tube called a catheter. Your surgeon will insert the catheter near your belly button, creating a port through which the dialysate will enter and leave your abdomen. Each peritoneal dialysis session is called an exchange. First, you will use your catheter to fill your abdomen with dialysate for a period of time determined by your doctor. Through the peritoneal membrane, waste products and extra fluid are continuously drawn out of your blood into the dialysate. Along with the waste materials it absorbed, the dialysate will drain out of your abdomen into a disposable collection bag during your exchange.